Whether IMR is offered in an individual or group format, you orient the clients to the IMR program individually. In your orientation sessions, IMR practitioners introduce clients to the IMR program. You get to know them better and assess their knowledge and skill levels. Your goals will be to help them understand the structure and content of the IMR program. It will help the clients understand their role in participating in IMR, as they have to play a factor into it as well. It would define common expectations for IMR participation, and it will assess clients' knowledge and skill level. You use the handouts to review and distribute the IMR handout. You'll orient them to the illness management recovery. There's a number of pacing, which is typically 2 to 3 sessions. The strategies you will utilize in each session will be motivational strategies, educational strategies, cognitive behavior strategies. Regarding motivational strategies used while orienting consumers to the IMR program include helping them identify Motivational strategies used while orienting consumers to the IMR program include helping them identify the benefits of participating and how the overall goals of IMR apply in their lives. While assessing their knowledge of mental illness and skills for managing their illnesses, reframe past challenges to show that the strategies they use to cope with these difficulties reflect personal strength, and acknowledge past problems or disappointments and express empathy, but help the clients focus on the future and what they might accomplish. Educational strategies for this topic help clients learn about the IMR program. The following educational strategies may be helpful. You review the handout by summarizing the main points or taking turns reading them aloud. You pause at the end of each section to check for understanding and to learn more about the client's point of view. And you allow plenty of time for interaction. Make the communication two-way. You are both learning something from each other. It is important not to ask questions too quickly, which clients may experience as an interrogation. Allow time to complete the exercises, as some clients will not need any help completing them, but others may appreciate assistance, such as reading words, spelling, or writing some of their own answers. Encourage the client to discuss their answers and break the content into manageable pieces. It's important not to cover more than they can absorb. Present information in small chunks at a comfortable pace. Use the questions at the end of the practitioner guide to assess how well clients understand the main points from this topic. And once clients decide to participate in the IMR program, give them an IMR binder that they should bring to every session to store handouts distributed through the sessions. Cognitive behavior strategies focus on helping consumers learn how to use the information in the session. It allows them to complete the knowledge and skills inventory. Not every question has to be answered. Help the clients make connections about how the IMR program can help them to achieve their personal recovery goals. The overall goals of IMR are to learn about mental illnesses and strategies for treatment, decrease symptoms, reduce relapses and rehospitalizations, and make progress towards goals and toward recovery. IMR practitioners will work side by side with them to help them move forward in their recovery process and provide information, strategies, and skills that can help one manage psychiatric symptoms and make progress toward their goals. IMR includes an orientation session to review the goals and expectations of the program. 1 or 2 sessions to get to know you better. 3 to 10 months of weekly or bi-weekly sessions. Active practice of relapse prevention and recovery skills, and optional involvement of significant others, family members, friends, practitioners, other supporters, to increase their understanding and support. By participating in IMR, they agree to work side by side with the IMR practitioner to move forward in the recovery process, to learn about mental illnesses and principles of treatment, to learn and practice skills for preventing relapse and coping with symptoms, and participating in assignments to practice strategies and skills outside of the sessions. Throughout the IMR program, they will strive, along with the practitioner, will strive for an atmosphere of hope and optimism, regular attendance, side-by-side collaboration, and making progress towards achieving their goals.